Good morning. It's time for our Henry County Health Center FYI. And this morning we have a conversation with the Information Technology Department at the Henry County Health Center. I've got on the phone Stacy Spidell and Sarah Rogers, both with us, and they're here to talk about an exciting new communication platform that's going to be offered to patients. So, good morning, ladies.
Good morning, Katie.
Good morning.
Thanks for having us today.
So let's just get started first, and if you would please both just explain, a little bit about yourselves and about the Information Technology Department at the Health Center.
Well, Katie, the IT department at Henry County Health Center has a team of 6 people, and we support our entire network infrastructure, all the computers, printers, all kinds of things that we use technology-wise within the health center. We also support our main electronic health record and a variety of systems and applications that are used in conjunction with that main electronic health record. And as far as my role goes, I'm the application and project analyst. I evaluate, manage, support the non-clinical applications of our electronic health record. I research and evaluate new and existing technology and help our different departments work to optimize their workflows. And then I manage projects to implement and update applications and systems that help us work better internally and for our patients. And that's one of the projects that we worked on here that we're here to talk about. I helped manage that particular project.
And Sarah, do you want to introduce yourself?
Yes, I am one of the RN clinical specialists here. I do work closely with Stacy on a lot of the projects and really optimizing workflows more on the clinical side. So I do help evaluate, manage, and support all the clinical applications that really are part of our electronic health records here for our patients.
Wow, you two have important jobs at the health center. So you're essential, you're doing so many things. One thing that you do is to utilize technology in a way that makes things more efficient and, of course, on our end of things, patient-friendly and easy for us to use. So talk about the new two-way communication platform that you guys are going to be implementing.
Well, last Friday, we went live here at Henry County Health Center with a product called Relatient. It's really one of the top patient engagement platforms for health systems and provider groups. What it does is it offers an auto texting, emailing, and voice communications that integrate with our scheduling system here at the organization for radiology, for the clinics, all of our departments here except for surgery. So it reads that scheduling data and it's able to send out appointment reminders. We are able to customize reminders for appointments so the patients can confirm, reschedule, or cancel through the text options, the email options, and the voice options for them.
Wow, so this sounds really convenient. How will this benefit patients and staff?
Well, patients that are wishing to receive appointment reminders are able to select their preferred communication method. They can either receive it, like I said, by email, voicemail, or a text message, or they can have all 3. They're not required to opt into this, but we believe that they're really going to appreciate this way of messaging and managing their appointments. The messages allow the patients the ability to confirm, reschedule, and cancel from email, phone, or text with just one click or a keypad option. Since we started messaging last week, we've really gotten a lot of positive feedback from patients. They really like being in control of how and when they receive the messages and able to review appointment information.
Katie, from a staff perspective, Relatient gives our staff a dashboard and allows an at-a-glance view of appointments across the organization. Then our staff are able to see who's confirmed, and they're able to also proactively contact patients who cannot make their appointment so they can reschedule, or contact patients who we maybe don't have their current information and follow up with them so they make sure they get their appointment reminders that way. If a patient misses their appointment, a reminder can be sent so they have the opportunity to reschedule. And this really allows HCHC to standardize the appointment reminder call process across the organization, and it provides visibility to all our staff that are involved in scheduling, so they can have a really good handle on who's coming in the health center, because some patients come in for multiple appointments in the same day. Maybe they're seen in the clinic and they're going to radiology. So this gives both radiology staff in that instance and the clinics the ability to see and know if the patient's confirmed and know who to expect to come in or who might need a call back. Hopefully this is going to result in improved communication and happier patients.
So how does it work then? I mean, talk to us a little bit and describe what patients can expect and how it's going to send messages and stuff.
Well, the product does look to our scheduling system. So if you've been here at the organization before and we have your email address, you will actually get an email for your reminder 5 days before your appointment. This reminder will include, your appointment time and some general instructions for the visit. If we have your cell phone number, calls, or your home number also, calls can be sent 3 days before your appointment and have the same information that the email does. And in these messages and calls, you're able to press a button or click on a button to confirm or reschedule that appointment. Then 2 days before your appointment, you will receive a text message, really just for the appointment reminder, and again, an opportunity for you to confirm or reschedule your appointment. Then, of course, the day before, the morning before, you'll receive a courtesy text that really just says, we're excited to see you at your appointment time.
Why did you guys decide to roll this out? I mean, why did you think, this is an important service that we need to be offering, our patients?
Well, Katie, that's a great question. We've got a little history. Back several years ago, and over time, we've been discussing implementing a texting solution. We did conduct in the past various surveys and got opportunities to visit with the patients and take that voice of the patient. And we wanted to hear what they had to say. And for quite a long time, and at that time, patients really expressed that they appreciated those personal reminder phone calls. And I think that's one thing that's great about Henry County Health Center is we're able to give really personal service, and we pride ourselves on that. And while that's a great way to personally connect with our patients, there are some limitations that we realize. Patients don't always answer the phone. They're not available to answer the phone to confirm their appointment. They don't have the ability to reschedule from a phone call. So there's no really good way to communicate some of that information back and forth. And it's difficult as well to communicate those appointment instructions for their appointments. So over time, we've realized that we had some opportunities to do better with how we communicate with our patients. And I think our patients are also seeing in other areas of their life where they're able to have appointment reminders sent via phone calls or messages, email, and particularly text reminders. And we're hearing more and more from our patients that they really want to be able to do that with appointments here at the health center as well. So because of that, that's really kind of what drove us to implement a service like this, like Relatient, that will allow them to manage their appointments in this manner.
Absolutely. So in technology, we're always looking to the future. Are there any added features that you guys might be implementing in the future?
Yes, actually we are. Initially, we're going to be translating these messages into Spanish because we know that that's certainly needed in our community. There's some other features that would include some secure messaging and chat features with the patients or their family members, maybe some broadcasting of some mass communication, such as inclement weather announcements. This is winter, and if we get a lot of snow, a lot of people can't make it in, including patients and staff. Also, the ability to maybe send reminders. This is your yearly reminder. Make an appointment with your provider. Child checkups. When moms busy moms get a little confused. When do I go? 2 months, 4 months, 6 months, a year? Maybe we can help with some of that. And we really, really like the ability to really complete some pre-registration processes through email or text. So we are going to be really looking at all those features in the future with this product.
Those texts and phone calls, I can imagine, are going to be just a huge, huge benefit for all of us. So this has been a fun conversation. Is there anything else that you wanted to say and let people know about while you've got the airwaves?
Yes, absolutely. In closing, we just really want to encourage our patients to provide their preferred communication methods so they can take advantage of the appointment reminders and any features that we will have that will come in the future, as well as our patient portal. We don't want to forget this is an opportunity to kind of plug our patient portal as well, because we already collect email information from patients for patients to access their patient portal. This was an easy service for us to provide, and we feel it complements the patient portal. But if you haven't already provided that email address, please, as a patient, feel free to give us that information. You can always call into the hospital and give your email, your cell phone number, and we can have it added into the system. Or on the day of your services, please be sure to give that to the person that's completing your registration.
Yeah, I was just going to ask, if somebody does want to look into getting any of this set up, do you have the phone number that they should call handy that you can give them?
Absolutely. They can call the main number of the hospital, 319-385-3141.
All right. Well, Stacy Spidell and Sarah Rogers with the IT department at the Henry County Health Center. I appreciate you ladies coming on this morning and giving us an update. This Relatient looks like a great new communication platform for patients and staff alike.
Thanks a lot, Katie, for having us.
Thank you so much.